Welcome to this video on a cohort study of Hyperemesis Gravidarum Anemia in Indian pregnancy, featuring clinical, laboratory, and exploratory bioinformatics mapping. This video follows a concise PG project format, focusing on core findings and essential methodology while avoiding unnecessary clutter. Hyperemesis gravidarum and maternal anemia are critical pregnancy conditions that can impact nutrition and health. This report integrates clinical data with bioinformatics mapping. We address the need for a clearer local clinical profile of these coexisting conditions, mapping findings to existing pathways to generate future hypotheses. Current literature links anemia to adverse outcomes and outlines methods for assessing Hg severity and iron metabolism pathways through bioinformatics. The aim of this project is to analyze the correlates of these conditions and conduct exploratory bioinformatics mapping using curated databases. Our study includes 98 participants from Mala Reddy Hospital. We utilized clinical data alongside R-based bioinformatics tools for our analysis. The workflow progressed from screening and symptom assessment to anemia evaluation, statistical data analysis, and finally, pathway mapping. Here are the participant characteristics. Please note that while our clinical analysis included 98 participants, ferritin data was limited to only 8. The prevalence of anemia in our cohort was 67.3%. This estimate is based on the hemoglobin definition used throughout the study. Regarding Hg severity, most participants fell into the mild or moderate categories, with only one participant classified as having severe Hg. Statistical analysis showed no significant association between Hg status and anemia status in our data, warranting caution in interpretation. Our bioinformatics approach identified enriched pathways by converting gene symbols into Entrée IDs, focusing on exploratory pathway-level visualization. The KEGG and GO enrichment results highlighted pathways related to iron metabolism and erythrocyte function within our study's genetic scope. Finally, clinical molecular integration revealed no statistically significant differences in heme biosynthesis pathway activity across the different anemia severity groups. In this section, we interpret our findings. We observed a high prevalence of anemia in the cohort, while Hg symptoms were mostly mild to moderate. Our analysis found no statistically significant associations, and our bioinformatics results serve as hypothesis-generating evidence for future research. In conclusion, our study provides a local snapshot of Hg and anemia. Limitations include small sample sizes for certain categories and the exploratory nature of our pathway analysis. Future studies are needed to confirm these preliminary findings with larger cohorts and more comprehensive data. This slide displays the selected references used throughout the report. Please ensure that all cited works are properly documented in your final thesis.